Don't expect patients to lip read. While some deaf and hard of hearing people are able to lip read, it isn't always the best. It's one of the least effective forms of communication. If they write something down and give it to you, don't respond in speech. Not everyone lip reads. Even the best lip readers miss quite a bit of communication. Even if a patient is comfortable lip reading, it's important to remember that only 30 to 40% of speech sounds can be lip read, even under the best conditions, and extra information is usually required to understand what is being said. Talking louder or slower does not help with lip reading and can come off as condescending. If your patient is comfortable with lip reading while waiting for an interpreter, speak normally, yet clearly. While lip reading should not be the only form of communication while working with deaf patients, allowing patients to see your mouth while speaking allows them to gather additional context, know when it is their turn to communicate, gauge tone, and use lip reading as supplemental information to the primary communication method chosen.
I am tired of having to constantly educate providers about my rights to communication as a patient. What is a reasonable accommodation to them may not be effective communication for me. It's exhausting and energy draining, and COVID-19 mask policies can make it impossible to lip read. And one person or no visitor policies make it really hard to have an on-site interpreter for those who need one. It's like they think it doesn't matter that I want access to full information. I dread medical appointments when that happens. I love when doctors are aware that I need to see faces to understand the emotions behind the message. One doctor was so flexible that he swapped his face mask for a clear mask.
Use lip reading as supplemental information, not the only source of information, and speak clearly and naturally using gestures and expressions to help convey meaning. Be willing to repeat or rephrase important information to ensure the patient has understood it correctly.